Hi everyone, this is a video that you're gonna get. It is 2:30 in the morning. Today was a snow day for me. And it was very boring. Here's Jokes. Say hello, Jokes. Kiss. In this video, I wanted to give information about Suboxone. And I wanted to reflect on the YouTube videos that I've been seeing about Suboxone. Now, Suboxone is a really great medication for people with opiate abuse disorder, and it helps them replace the opiates with Suboxone and helps them with the withdrawal symptoms and the cravings. And some Suboxone users claim that they do get a little high from Suboxone, and I actually saw a news thing on YouTube about someone dying from Suboxone, but overusing Suboxone and not using it as advised is not okay. So I'm going to list some scenarios of ways that you could improperly use Suboxone. And I'll just list the contraindicated medications. So one of the main contraindicated medications is benzodiazepines. So this goes along the lines of Valium, aka diazepam, Xanax, Ativan, trying to think of all the other benzodiazepines. And if you're worried about it, you could research whether or not you're taking a benzodiazepine. Also, overusing Suboxone, aka overloading on the medication, is not advisable. Also, when you are on Suboxone, you should refrain from any alcohol consumption because it is contraindicated, and again, it is putting your life more at risk if you're drinking alcohol on Suboxone. And it all depends on the person's body, and there are those labels on the prescriptions for a reason, and it's all up to the person. Now, when it comes to Suboxone being something that could be addictive, is kind of a weird sort of psychological thing, because an opiate addict is supplementing their drug of choice with Suboxone. And one thing Suboxone isn't is a full-on opiate. It is a narcotic, it is a controlled substance, but it doesn't have the components that make you feel high. It may help with pain, it may help with withdrawals, but it's not there to make you feel high. Another contraindicated medication is methadone. So some patients take methadone and Suboxone at the same time. This is really not advisable. I don't know why people do it, because methadone and Suboxone are very different medications, but they are there for the same need. And taking two at once could be very dangerous for someone. What else? High amount of opiate usage during taking Suboxone can be a risk of overdosing. And the way I quantify that is over 180,000 NGs, whatever that means. So anything past that point, we immediately give that person a Narcan kit. Now, if you never heard of a Narcan kit, I'm sure there's a clinic out there or a provider that could provide you with a Narcan kit. It is a lifesaver for someone who is going through a overdose, who is about to die, and you can administer this Narcan kit and it could save their lives. What else? You know when you're abusing your Suboxone. I think addicts are really intelligent about their addiction, but they're also very stubborn about their addiction. And some people don't take it as advised, and some people sell it, and some people like overuse it, underuse it, who knows, whatever. You're putting your life at risk if you're trying to mix up drugs together, and also if you're still using while on Suboxone. It can be effective if you result in stopping those opiates. And that's what's ideal. Now, I'm a high believer in harm reduction, and there's a lot of methods about harm reductions, aka relapsing. There's groups, there's therapies, there is recovery engagement when it comes to getting prescribed Suboxone. It depends on the state, it depends on the regulations. Some people just get it from their doctor, some people choose to see a therapist, some people get it at a public clinic, which is where I work, and you have to be engaged in treatment in order to stay in our clinic. And that is to ensure that a certified counselor is checking in on you, knowing your scenario, being there for you, and guiding you to the right way. And what else? If you are pregnant, there is Subutex, and that has one ingredient lacking in Suboxone but can aid in people who are pregnant. And also, Suboxone is supplied in either strips, which are extremely expensive. So if you have the Suboxone strips, feel grateful. But usually they're dissolvable under your tongue, and it takes about 20 minutes to dissolve. What else? What was I going to say? Tapering off Suboxone. So if you feel like you're at a point where you want to get off Suboxone and you just want to cut off all the elements of Suboxone and you just don't want to be associated with Suboxone anymore, there is a taper, and there is concrete steps that you should go through when you're tapering off Suboxone. Number one, you should be under a doctor's advisory, whatever you call it. He or she or they should know what is going on with your body. If they approve of this taper, how they want to proceed with the taper, have a doctor guide you through this taper. Also, if you feel like you aren't in a place of stability, let's say your environment is extremely toxic and very stressful, and you feel like getting off Suboxone will, you know, put you at ease of getting off Suboxone, but you might just relapse again. There is that risk. So you have to be at a good place in your life where you feel like you've gone through all the cravings, your life is manageable, you have this goal, and also don't set these goals up to the highest amount. Just do baby steps. That's what I advise. Baby steps. Just like Alicia said, I think. She said that she didn't want to put herself into a goal and then have herself not succeed in it. And she said to herself, well, maybe a few months on this dosage of Suboxone is good for me. And that's exactly what I'm trying to say. Where it comes to Rockin' Roberta, she is totally fine when it comes to tapering off her medication. She, what I believe, isn't experiencing cravings. She's not experiencing any sort of relapsing. And it is doable if you are in the right mindset. To be in that right mindset, mind you, it takes a lot. It takes a lot out of someone. So if you're someone who is looking into Suboxone to help yourself get off opiates, it may be a long journey. It may be a learning experience, but I just encourage some group involvement, counseling, having a doctor, talking with the doctor about Suboxone, what dosage is good for you and your body, and what you're doing with your body while on Suboxone. And also, when you want to finally taper off Suboxone, are you ready to be completely off Suboxone and just live life drug free? Now, I believe Suboxone can be a long duration of your time to be on it. I haven't seen any research on how harmful it is. It is harmful if you overuse it, obviously, if you're addicted to Suboxone, which is kind of unheard of. But anyway, I thought I would make that little video about Suboxone, and hopefully that answers some questions. I wanted to give an informative video, and it is at 13 minutes, and I can't hit the 15-minute mark. If anyone has any questions, please ask below. If I can't answer it, I'll research it or ask my supervisor. So if you have any questions, please, I want to do a Q&A, even about me, even about my life. Go down below. And I hope you guys are having a good night. Bye.